I apologize I couldn't be there in person this year, and I want to thank the course directors for allowing me to give this talk remotely on femoral osteotomies. These are my disclosures. There's nothing relevant to this discussion. In this talk, we're going to first go over the extensile exposure to the femur for hip revisions and a stepwise approach to getting this access, and then we'll talk about removing well-fixed femoral stems and whether or not an osteotomy is needed in all these cases. Finally, we'll talk about several osteotomy options and when to use them. Before removing any stems or performing any osteotomies, we first need to get access to the proximal femur. The first step is just ensuring that all your releases are complete, most especially the pubofemoral ligament and the posterior lateral capsule. Before I go any further, I make sure that the entire anterior fascia of the tensor fasciae lata is released, and then in stepwise fashion release the TFL from the anterior superior iliac spine if necessary. At this point, I can extend myself longitudinally into a limited subvastus or interbundle calcar exposure, and then finally a full distal extension into a subvastus approach. For distal extension, I tend to favor the full subvastus exposure as described in this paper by Dr. Nogler. This can be done by a lazy S incision extending directly down the thigh or through a dual incision approach. In this case, a lazy S incision is made extending down along the lateral aspect of the thigh. You can see here in this cadaveric specimen that we first elevate the vastus lateralis and then place retractors underneath the vastus lateralis after dealing with the perforating branches. However, before choosing to do an osteotomy, there's several things that you can do in order to remove a well-fixed stem, and in most cases with modern tapered wedge designs or all metaphyseal stems, these stems can be removed without an osteotomy. On the next slide, you'll see a video demonstrating my technique to getting out most stems before I choose to move on to an osteotomy.